This video is about the benefits of water fasting and what they are. Fat loss is a no-brainer. You're going to lose weight when you're fasting. Here is before and after pictures of my experiment with a 3-day water fast. The results of my fast were pretty telling. However, what's more important is what does the science say about fasting? We're going to look at a meta-analysis. Which is basically a compilation of 28 different studies where they compared all the results and they came up with these findings. So they compared a group of alternate day fasting against a very low calorie diet, and it was very easy to see the very low calorie diet actually lost the most weight. However, they lost the least amount of fat mass and the most amount of muscle mass. Obviously, we should all be trying to keep the most amount of muscle mass on our bodies. These findings make it really clear that fasting definitely trumps cutting calories for losing fat. Our next benefit is joint pain and inflammation. I've often used fasting for relief from such things as plantar fasciitis, shoulder pain, knee pain, back pain. I was even more intrigued when I looked at the scientific studies that talked about fasting and rheumatoid arthritis pain being relieved. This particular study talked about how fasting limited oxidative stress, inflammation, and attenuates pro-inflammatory cytokines. Fasting therefore limits inflammation, therefore limits pain. So if you're a hard-charging athlete or you just have a lot of chronic inflammation that you just can't seem to get away from, I highly recommend fasting. Okay, so our next benefit is fasting boosts your human growth hormone levels. As we age, our growth hormone naturally decreases year after year. I encourage you to look up these studies that talk about the impact of growth hormone and how it has anti-aging effects, how it has anti-inflammatory effects, and of course growing muscle mass. And one of the greatest ways to get this human growth hormone benefit is fasting. Fasting elicits a huge response of human growth hormone. Fasting has the ability to protect against and even reverse type 2 diabetes. Here's one study that fasting's been shown to normalize beta cell function in the pancreas and actually normalize the production of insulin from a type 2 diabetic. This means someone who is given insulin by their doctor because they can't produce insulin could implement fasting and actually start producing insulin naturally all over again. This next study actually compared eating 6 small meals a day to intermittent fasting and eating 2 large meals in a day. They took 2 groups of people, they fed them the exact same amount of calories. Only difference is one group had 2 meals a day, one group had 6 meals a day. The results were pretty shocking. The group that did the 2 large meals, they had the most reduced body fat, they had the most reduced liver fat, they had the lowest fasting glucose, and the greatest insulin sensitivity. If you're suffering with type 2 diabetes, I highly recommend you follow Dr. Jason Fung. He's got the most experience clinically with fasting.
Why can't you fast, right? I asked my son one time, a few years ago, how do you lose weight? He was 6 or 7 at the time. And he goes, just don't eat. So easy, right?
Dr. Fung is clearly showing that you can reverse type 2 diabetes with simple dietary approaches, including fasting. His program is called the Intensive Dietary Management Program.
If you don't eat, you're going to lose weight. And here's the thing to understand. There's nothing wrong with it. That's the way we're built. We're built to withstand these repeated episodes where there's no food. Right? Because back in the caveman days, there's no McDonald's, there's no refrigerator, there's nothing. There are times you're going to have nothing. That's why you have fat.
It's really simple. If you clear energy out of the cells, then the cells aren't cram-packed full of sugar. And once those cells are freed up, then sugar has somewhere to go and it doesn't hang around the bloodstream. People commonly say that when you fast, your body's going to slow its metabolism and you're going to run into all kinds of metabolic problems. However, these studies clearly show that after a 4-day fast, there was actually a 14% increase in energy expenditure, and that's likely due to the fact that we're going to need to go out and expend energy to find more food. Again, I can't emphasize this enough. If you're a type 2 diabetic or someone you love is a type 2 diabetic, I highly encourage you to do your research, do your homework on fasting and what this can do to reverse type 2 diabetes. Fasting also reverses hypertension or improves blood pressure. In this study, after 13 days of water-only fasting, 80% of people dropped their blood pressure by 20 points or more, and it stayed down once they resumed eating again. Yes, that means you can get off of your blood pressure medication fairly quickly if you implement some fasting in your routine. Fasting has also been shown to boost your immune system, which actually protects against aging. And of course, none of us want to go through the process of getting older. Fasting has been shown to really play a crucial role in stem cell protection and self-regeneration. In other words, these mechanisms actually boost our immune system and protect against aging all at the same time. Fasting is amazing for detoxification. We are exposed right now to more environmental chemicals than in any other time in human history. I commonly use the example of if you're always having company over at your house, when do you have time to organize and clean your house? In other words, if you're always taking food in, when does your body have time to detox and clean up shop? Multiple studies have proven that fasting for a period of time can eliminate body waste, diminish gastrointestinal irritation, and refresh the digestive and respiratory systems. Again, I can't emphasize this enough. If you're dealing with poor detoxification or lots of inflammation, fasting should be an integral part of your routine. Fasting has also been shown to improve digestion. In this study of 84 participants who had IBS, they wanted to see how fasting actually improved their symptoms. The fasting group showed 7 out of 10 symptoms were relieved, whereas the control group only showed 3 out of 10 symptoms relieved. So most importantly, when it comes to fasting, I think precautions should be taken. I think that fasting should be started very slow and titrated up. Just like any other form of training, you're training the body to go without food and to burn fat for energy. And sometimes that's a process that takes just pushing breakfast off until 10 or 12 or 1 or 2 before you go for a 24-hour fast. If you want to learn more about fasting, ask me any of your questions in the comment section below. I'd be more than happy to share my experiences with you. So if you like this video, you learned something from this video, please hit the like button for me down below. And share this with a friend. Share this with somebody who thinks fasting is crazy. I couldn't fast. And as always, stay tuned for more here at musclesandveggies.com. Hit the subscribe button so you can stay tuned and learn with me as I learn. Thanks for watching. Zach from Muscles and Veggies.